Lifestyle choices may help keep your brain and body healthy. I'm Jerry. I own Touching Hearts at Home. It's an in-home non-medical agency. So the first one we're going to focus on physical health and exercise. So cardiovascular, again, that heart-lung process activity may reduce your risk of cognitive decline. Regular and vigorous exercise leads to increased blood flow. Other physical activities may also yield benefits. So walking has been shown to decrease any depression symptoms as if you're taking an antidepressant. If you walk for 20 minutes or more per day, your chance of depression goes down. I do know someone in another facility locally here that was a marathoner, and she still got dementia. So whether she was marathoning like a year ago, so I would imagine she still had dementia and did marathon, but she ran marathons her whole entire life. So, but she still got dementia, but I believe it, and she's still upright. She's still able to go. So it's like the progression of the physical factors where you can't walk, you can't talk, you can't go to the bathroom by yourself, that might be slowed down just a bit. So habits take a while, 3 to 7 weeks to get a good habit involved. So, start small and go to the pace that you can handle. Physical health and exercise, what we can do something you like. If you like walking, if you like biking, especially this time of year. We talked about starting small and increasing as you can. Move safely. If you have any balance issues, that can be a consideration. So if you need a walker, use the walker. It's there for your safety. Get your heart rate up as much as you can. And I would imagine you have some kind of activity here that has them doing chair exercises or something to help with that. Yeah, exactly. Ask your friends to join you, bring other people along, and then check with your doctor if you need to before you start. So you're making sure that you're safe. Physical health, so stop smoking if you can, avoid excess alcohol, get extra sleep or at least adequate sleep. Sometimes as we age, our sleep gets a little bit wonky. So there's something called sleep hygiene. Doing the same thing every night before you go to bed can be very helpful for your sleep. Avoid a head injury. Well, if you have balance issues, using your walker is a very beneficial thing. It just takes one fall to cause a head injury. So just be very aware of that. Manage stress. That's something we all need to work on. How do we do that? Mind over matter sometimes, but if you need a therapist, get a therapist. If you need to exercise more, that can be a stress reliever. There's all kinds of modalities out there. I've recently picked up something that's very interesting, but it really helps me feel very relaxed. So I can talk to you about that afterwards. And then treat depression. And we talked about walking can be just as effective as an antidepressant. But if you need antidepressants, make sure that you get them. That can be very beneficial to help decrease your stress. And then visit your doctor regularly to make sure there's nothing going on that could be causing extra stress. When we don't feel good, we often mentally don't feel good too. So physical health and exercise, monitor your numbers like blood pressure, blood sugar, keeping your weight in an adequate location. I know it's easier said than done, but that is a really beneficial thing. Those with a lower weight often have less chance of having stronger dementia symptoms. And then lowering your cholesterol, that can be beneficial as well.